2:30. Welcome to CCDPH Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department, and I am your host and moderator for these weekly webinars. Thank you for joining us on this hot Friday afternoon. Let's get started. As usual, we like to give our objectives is to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions, and provide CCDPH contact information and resources. Couple announcements. All of our webinars are recorded and they are uploaded to CCDPH's website as well as our YouTube page. I believe the last couple weeks are on our YouTube page and on our website. So all the recent webinars should be up there for you to use at your leisure. And of course, all of our slide decks are emailed after the webinar, usually on Mondays when they have the opportunity. So a couple housekeeping things. We began promptly at 2:30. I've been getting a lot of emails at 2 o'clock, before 2 o'clock, 12 o'clock, 1 o'clock, requesting to get let into the webinar. I know you're so eager to see my wonderful smiling face, but just as a reminder, we start promptly at 2:30, so it's not necessary to email me. I'll be there for you. I'm not going to miss out, okay? So please keep your lines muted, and the chat is disabled during the presentation, and they will be turned back on during Q&A so that everyone can hear the updates unencumbered. Little contact information, our general COVID-19 information, our CCDPH COVID-19 general email where you can ask questions and get your answers and also submit questions for the upcoming webinars, and our communicable disease reporting email if you have diseases that you'd like to report, not just COVID. Any communicable diseases you'd like to report, you can report to that email. It's probably a little easier than trying to contact someone over the phone. Our general Cook County Public Health website, cookcountypublichealth.org. If you'd like to access our schools only page, /school-health, and also vaccine information page is vaccine.cookcountyil.gov. And there are also communication tools for COVID-19. If you would like to print those and share them in your facilities, that is listed below. As a reminder, all of our mass vaccination sites are closed. For those who participate in the EpiPen prescription program, Keith Wynn is no longer the contact person for that. You should be aware of that now, but we always have some newbies, so you can send all those requests to me, kjones1 at cookcountyhhs.org. Those requests must come from a medical professional, i.e. school nurse, or the person has to be trained on the administration of medication. There's a lengthy process to be certified if you are not a medical professional. So those have to come from either one of those, and all the requests must be typed. Just a reminder, we are trying to give extra resources and support to the following communities who tend to have the lowest vaccine uptake numbers. So we're trying to do more local efforts and do vaccination sites and have more resources poured into this community. So if you have an event that's coming up, if you'd like some information on how you can assist these villages, please let us know. You can reach out via the email address below. And as an aside for those vaccination sites, we are having a mobile vaccination site at River Oaks Mall in Calumet City next week. It is September 21st, 20th, 21st, 22nd, 25th, and 26th. A little confusing, but it's Monday, Tuesday, Wednesday, Saturday, and Sunday with the upcoming return date for those second doses. And it'll be from 10 to 6. Also, there is a vaccination event happening in Dixmoor on Monday and Tuesday of next week with that second dose on October 12th. So all of these flyers and all of this information will be sent to you with the webinar slides. There's more information on our Cook County Health website of upcoming community calendar events. It is updated regularly, so you can check that out to see if there are any events that you may want to participate in. If your school has an existing COVID-19 testing program, we'd like to find out about it. There is a link at the bottom of the screen, and a link will also be in that email. So we'd like you to fill that out so we can find out more about what you have going on. Also, there is the rapid antigen testing program, and the Cook County Health Department is available to give those testing kits. I heard from Lex last week that IDPH is no longer able to submit those kits because they've been inundated. So they're no longer able to accept new requests. They're only filling current requests. So the information is there. And here's information on how to set up shield testing for your school. If you need to make that request, you can email them at the following email address. If you'd like to have a professional come to your event to speak on COVID related subjects, there is a speakers bureau that has been set up that has qualified professionals who are able to come to your events to speak on those matters. It will ask you questions such as the event, language preferred, how many people, et cetera, et cetera. So all that information is on that Google Doc. If you need a ride to get your vaccination or you know someone who needs a ride, they can request that at 833-308-1988. They'll take them and then pick them up and bring them back home. You can also call this same number in order to get an in-home vaccine for people who are 65 years older or have a disability, use adaptive equipment like a ventilator or crutches, or can't leave their house. And that is only for people who live in suburban Cook County, barring City of Chicago, Skokie, Evanston, Oak Park, and Stickney, as they have their own certified health departments separate from Cook County. Some more resources there. And I just found out about this grant program through EPA for schools. I'll read a little bit. So, what the grant program is, there is the EPA's Office of Community Revitalization received American Rescue Plan funding to develop and implement local strategies for using available COVID related dollars to create cleaner air and neighborhood cooling refuges for vulnerable communities. So there is a grant process. There are a couple schools that they are able to provide this with. Someone will come out and consult and see how they can make those changes. And the due date is September 30th. You will get this emailed to you. And I tried to get the EPA rep to hop on our call to explain more, and I wasn't able to get that person booked, but I still think it is a great opportunity for any schools that are at risk that may need this extra help. So I'm sending that information on to you all. I'm going to stop sharing and I will see if Dr. Corpix, if you are on, then we could go ahead and do your update quickly. If not, then we will go ahead and toss it to Lex.
Hi, thanks, Kelly. I'm on. Can
Okay,
you hear me
great.
okay?
I can hear you fine. So I've gotten quite a few emails this week regarding Binex questions. So we thought it'd be a great idea to have Dr. Corpix on to answer your questions. So I'm going to enable the chat so that you can enter your questions for Dr. Corpix. So go ahead and take it away, Dr. Corpix. I'll start the chat for you.
Okay, great. Thanks, Kelly. So a few updates. So in general, working with the SHIELD program is a good idea. I know that they have somewhat of a wait just because it's so popular, but I do recommend any school get on that program. The SHIELD program works with both SHIELD and Binax now. Uh, and then they also help facilitate getting standing orders as needed from physicians, and then help with CLIA numbers. So if that's an option to your school, I'd definitely recommend it. The SHIELD test is considered, a really good test. For people who are, but then I will add that we also have, separate from that, the Binax Now program through CCDPH. And so whether you got your standing order from through and CLIA through SHIELD, or you got your CLIA number on your own and you got your standing order from me, because I am the contact to get the physician standing order from CCDPH, you can either order tests from CCDPH, in which you have to come pick up those tests in Oak Forest, and you have to order them on our Red Cap survey, which is on our website, and you have to order weekly as needed. And then you wait for a confirmation and pickup times, usually from Jameen Shelton. And then IDPH has informed us that they are doing direct ship to some schools, and their recommendation is just that you email that DPH antigen email at illinois.gov. And then that information is also on our website, both on the testing website and the school website. And then that would be how you would request a direct ship of Binax Now tests so that you don't have to pick them up from the Oak Forest location at CCDPH. We did communicate with the state, and they are now saying at our discretion in our standing order, we can allow people to like non-healthcare professionals to administer the tests as long as they're adequately trained. And so that can include self-swab, but if you are the person self-swabbing, you have to be adequately trained. And so if your school plans to do that, then you can reach out to me if you need it in writing, and I can send you the updated standing order. I think those are the main updates because before, the state had said only healthcare workers are allowed to administer the Binax Now test. So that's what our old standing order states. In terms of tests that are allowed and not allowed, I definitely appreciate, and understand confusion. So in general, and I have some links that I'd like to share. I can send, I'll try to put them in the chat, or I'll send to Kelly to send out later. In general, there's a few different links I like. The FDA website does give a nice overview of what's a molecular test and an antigen test. And in general, the molecular tests are much, so a molecular, uh, so we have like the NAAT test, which we call the NAT, and then we have the lab-based and the point of care, and then we have our antigen tests, which rely on picking up a protein from the virus. So two different tests with different sensitivities. And so right now in this time of high transmission, we're being very particular about the test. So we're wanting a lab-based NAT test to be the confirmatory test. And I definitely understand the confusion because in general, it's easy to tell if something is an antigen versus a PCR test or a NAT test. And in general, the PCR NAT is much more sensitive than the protein or the antigen test. But in the terms of separating out the two PCR and NAT tests, if it is point of care and not sent to a lab, it's considered to be a little bit less sensitive. And so that's why we're being so strict. And that's actually per the guidance directly from the state. So if you have any other questions about that, I definitely know that it's very confusing, and the websites really vary on how well they explain the difference between the two, but I will share links in the chat and or with Kelly. And then if anyone else on the team wants to comment, especially from the CD team, that would be great.
Thanks, Dr. Corpix. There were a couple of questions in the chat. I'm not sure if we should reserve those for Lex, and I'll just read them, and then we can decide whether we'll reserve those for after Lex's presentation. And please send me those links, and I'll add it to the resources when I send out the email later on. If a student is positive from a Shield test and then the parent takes them for a PCR test outside of school and it's negative, can the student return to school? I think this is a Lex question. Is that correct? Right, Lex?
Sure, I can take it. If someone tests positive, they are positive. Positive is positive no matter what test it was, and from that point on, they are isolating, and you cannot test out of isolation. You have to be isolating for those 10 days total. So even if, a lot of people are probably going to get through their infection, especially like a 12-year-old is going to get through their infection pretty quickly. And by the end of the 10th day, they might not even be testing positive anymore, but that doesn't mean that they can just return before 10 days. So once they test positive, they're isolating. Even if a follow-up test is negative, they're still considered positive. I think there were 2 questions about that in the chat, so hopefully that addresses both of them.
If there are any more questions regarding Binax, This is a time to ask them now while we have Dr. Corpix. Otherwise, we can start with the communicable disease update. Here's one question. I have a few positive Binax now that didn't clinically correlate and PCR was negative. Can you expound on that, Amy Carlson? I'm not sure what the question is.
No, she just said a positive is a positive regardless of
Okay.
which test. And so I've had this situation, I've been using Binax now since November, where we've had a positive Binax that just didn't clinically correlate. They had no exposure, no symptoms. They might have been testing. I don't know why they were testing it because I can't think of a specific situation, but I would send a confirmatory PCR. And if the PCR came back negative, I used the PCR as the test since it's more specific. So I was just curious if that seemed appropriate to you.
Did you want to respond,
Yeah,
Dr.? Okay.
yeah, that's appropriate, and hopefully I'm not in conflict with the school team. But the one of the problems with the Binax Now tests is that they can have false positives. And so as long as the person, and it definitely, I'll defer to the CD team to comment further in regards to the decision-making tree. But if you're talking about someone with no symptoms, then I would definitely trust the PCR test.
Okay. Thank you for that. I'll let Lex make the decision about if she wants to wait to address these questions afterwards. Oh, here's a couple Binax test related questions, so this is relevant. We tested our Binax test with water as a placebo and got a positive result. Have you seen this in other areas?
I'm sorry, what was the question?
The question said we tested our Binax tests with water as a placebo and got a positive result. Have you seen this in other areas?
Oh, I'm not sure, but again, one of the issues with the Binax Now is that it can have false positives. I don't know about the water specifically. I don't know if anyone else on the team can comment on that.
Halleck is shaking her head. She doesn't know either. Okay, I'll get the next question. If we are using PNC for our Binax Now test, do we still need to fill out a survey at the end of the day for the state?
If you're using the, how are you reporting? PNC, I'm not sure what that means.
That's me, sorry. It's the point and click through Binax Now, through Shield. Because I got two emails. One to say we're not using RedCap, we're doing the point and click.
Oh,
So is that
okay, so you're reporting through the Shield program.
Yes.
My understanding is that gets reported to the state, so you wouldn't have to double report. But if you're not a part of the Shield program, then you would have to report into RedCap. I don't know if Pollock or others know, but that's my understanding that all Shield tests get reported to the state.
Okay, perfect. Because I just got a separate email saying that I had to do that, and I was like, wait a second. So, okay, perfect. Thank you very much.
Thanks for that, Dr. Corpix. So I'll let Lex make the decision how we're going to proceed.
I copied and pasted the questions I want to address at the end, and some of them will probably just be addressed through the course of my presentation. So I'll go back into the chat and look at those at the end, if that's okay with everybody.
No problem. You have the floor.
Okay, let me go ahead and share my screen. All right, luckily this isn't like super long today because there's not actually that much new written and published documentation. Oh, and for those of you who don't know, I'm Lex Berta. I'm one of the communicable disease epidemiologists at CCDPH, and I'm a CDC infectious disease fellow. Just a reminder, the chat will be open at the end of the presentation, and we will toss questions to Dr. Corpix if they're about Binax, and I will toss questions to Pollock, who can answer in the chat and out loud. So without further ado, before we get into it, I do want to say we do not know when IDPH guidance will be published. We are also on the edge of our seats waiting for it. There's just a lot of hoops they have to jump through, and whenever something changes, that process starts all over again. So hang in there. Some things, like if we're gonna let things be policy before that documentation comes out, I promise we'll let you know. But right now we're just going with what's written and what we've told you previously in other weeks. So today, housekeeping, metrics update, travel updates. Pretty much the only new information is we're going to go over mask exemption documentation because we've gotten a lot of questions about what's acceptable for that. And then I just included the slides that were new last week, the music guidance that was updated, and just outbreak testing for you guys to reference. We won't actually talk about it. And then a couple of submitted questions. Just a reminder, we do keep regular business hours at the health department. There's almost always an epidemiologist on call, but if it's outside of our regular hours, we're probably only going to be addressing outbreaks. So if you send something that's not an emergency outbreak situation, we will try to get back to you, if it's on the weekends, Monday or Tuesday, or if it's like after hours at night on a Wednesday, we'll try to get back to you on Thursday or Friday. And just, if you're looking about, you're not sure how to write your report of a case or something like that, I promise our website has links and documentation for any more basic question you could possibly be asking. So check out there first if you're not sure, and it also lists all the contact information you need and where to send those questions you may have. This is the email you have to remember if you haven't used it already, ccdph_schools@cookcountyhss.org, and that is for any communicable diseases. Right now, it's almost entirely COVID, but if you're worried, you got stomach flu going around at your school, you can use that email as well. And then again, please don't forward our personal emails to parents to contact us about quarantine. We're not going to argue with them about quarantine. We don't want to get into a situation where we have to court order something. So don't pass that on. But also at the same time, make sure you're keeping track of any of the dates you've determined or we've determined when someone can return, because there have been people faking release letters. So just keep an eye on those dates so that you can cross-reference it with what you've actually documented. And then if you haven't already, now is the time to get parental consent for outbreak testing. That doesn't mean you're going to be regularly testing those kids. It will just help keep students, in school if there ever is an outbreak situation in their school. Otherwise, by the time consent is obtained during the outbreak, it's possible that that student will have missed some school waiting for that documentation to get through. Just, be proactive with stuff like this and talk to parents about that just being a possibility. Okay, so metrics update. Like in terms of cases, positivity, we're kind of about where we were at last week, but the number of school outbreaks in Illinois has more than doubled to 206 currently, and 26 of them, also doubled from last week, are in Cook County. We're obviously still in high community transmission, and there's a lot of outbreaks related to like football and high-risk sports, so just keep an eye on that. That's where we're at. Compared to like our current levels, it was about November of last year, if you can remember back that far, because time doesn't really mean anything that much anymore. So travel guidance, again, pretty much the entire map is a no-go zone, except for Connecticut or DC if you were thinking about going to the National Mall or whatever is in Connecticut. If you aren't vaccinated, you shouldn't be traveling. Unvaccinated kids should not be traveling right now. It is really inadvisable. If travel does happen, that means unvaccinated kids or staff or whatever are going to have to miss work and school, and they're going to have to be accommodated for those things, creating extra work for everybody, but also, they're missing out if they've gone on vacation and now they have to stay home for 7 full days or 10 days. That's a lot of things to miss just for like visiting a cousin in Minnesota or something. All right, new information. Let's talk mask exemptions. A physician may determine a child is medically unable to tolerate a face covering if they have some kind of contraindication, like they've got some breathing issues or anxiety about having something covering their face, things like that, or if the child is developmentally delayed and they would be unable to remove their mask or put it back on if they needed to. The certification of this mask exemption has to come from a healthcare provider licensed to practice medicine in all branches. So a lot of the questions we've been getting is from a note from a chiropractor. We're not taking notes from chiropractors. They're not licensed to practice medicine in all branches. The face covering exemption order needs to include a detailed description of, like, and that includes the diagnostic code of the medical condition, and an explanation of why that condition would impact their ability to be masking at school. And then if there's any alternative solutions that could be put in place, like they can't wear a mask, but they would be fine wearing a face shield, or they can wear a mask, but only in limited amounts of time, so they need a certain number of mask breaks. There's certainly flexibility if a physician thinks that that's appropriate in there. And then, of course, we need their state license number, their specialty, and their board certification. So there's a lot of details that go into this, and that's because if you can tolerate a mask, you need to be wearing a mask. If a face shield is determined to be okay to be worn instead, a strict 6 feet of distance needs to be kept, but it's still, certainly better than not wearing anything. And then test to stay protocol isn't available to those who are unable to mask at school, because one of the requirements is that both parties were masked and correctly and consistently masked during that whole entire exposure. So that's it on mask exemptions. And then this is just the updated music guidance from last week, outbreak testing information for you to reference, and then submitted questions. We've actually had a lot of questions like this first one. So first, North Shore offers a 1-hour PCR test. Is this test acceptable for early quarantine release? On their website, I wanted to look it up and see what this 1-hour PCR test was. They do differentiate between the rapid PCR and the standard PCR, which the standard PCR, as Dr. Korpick said, is going to be sent off to a lab. That rapid 1-hour is a point of care test, so it's a little bit less accurate than the standard PCR. At this time, we're only accepting the gold standard RT-PCR, or what they refer to as the standard PCR, on North Shore's website, and that's the one that's going to be sent off to the lab. I had one done a few weeks ago, and my results came back like, it was certainly within a day, but they usually take like half a day to 2 days to get your results back. If you're getting results within 1 to 2 hours, that's a rapid test or a point of care test. Second question, and this is really unique, I'm really glad this was submitted, it's super interesting. If I have a fully vaccinated student who's under the age of 12, but involved in a vaccine trial, do I now count them as a vaccinated person and apply all the same rules even though the vaccine isn't currently approved for that age group? So my first question to that would be, how does the student's family know that the student actually received the vaccine dose and not a placebo dose? Usually in these studies, there's a series of blindings so that even the person who's administering the dose doesn't know what the person who is getting the shot actually got, because it could change their reaction if they knew and they were like reading that person's face. So there's a series of blinding that happened. If the study can verify and provide that documentation that the student actually did receive those doses and is in fact considered fully vaccinated, if you can provide that documentation, then sure, operate under the guidelines for fully vaccinated. But I have a feeling it might be difficult to get that documentation just because of the way these studies work. And unless you can get that documentation saying that they were not placebo shots, this person is fully vaccinated, then they're just going to have to operate under guidelines for those who aren't fully vaccinated. I think I heard on NPR the other day that they're really pushing approval for younger age groups. So like, keep looking for that. They had said September originally, but probably sometime this fall. So hopefully soon. And then I guess if they did receive the vaccine, then they're the first to be considered fully vaccinated in their age group, which is great. Would CCDPH be willing to compile a list where we could send our students for a PCR test that you approve of for a student with symptoms? So this is actually an impossible task, unfortunately, because we don't know what tests are available at private practices, and that changes all the time. Like, depending on the availability of tests, they may say like, you can only get tested with this type of test if you've had this type of exposure, or if you don't have symptoms, you only get this type of test. So we can't possibly create a list that lists that, but I did put up the link for all of the Illinois like free testing sites where they can go. And just in general, I would advise anybody, if you're going somewhere to get a test, call ahead and ask what kind of tests are available. And again, as I said with the first question, if you're going to get results in 1 to 2 hours, that's a good indication that that's a point of care test and not a full standard RT-PCR test that gets sent out to a lab. So hopefully that helps a little bit with that. Next question, the test to stay guidelines state it can be used when both were masked properly during the exposure. What if the exposure took place during lunch? If the exposure took place during lunch, masks were not being worn properly. People are eating, people are talking, there's lots of airborne particles going. If they were like 3 feet apart and waiting in line for the vending machine properly masked, that might work for test to stay, but that proper mask usage has to be observed by someone who's, keeping an eye on the lunchroom, for example. So if you cannot confirm that proper mask use was happening in the lunchroom, lunch exposures are just pretty much blanket sweep, like it's not going to work for test to stay. If a student has COVID symptoms and is sent home from school, how long can their asymptomatic siblings stay in school? 24 or 48 hours. I do apologize for causing confusion with the 48. The documentation that hasn't come out yet, but we are working under at CCDPH is 24 hours. So they can stay, they don't have to be sent home that day, but they can't go to school the next day, for example. Submitted questions continued, just a couple left. How is Binax best used in the school? If we have a student that is symptomatic and Binax results are negative, are we safe to return the student staff to class? Do they still have to get a PCR test? So right now, in our current transmission levels, Binax tests can be used for outbreak testing and for test to stay. Those are the best uses for it. A student who goes to the nurse's office or the health office with COVID-like symptoms and tests negative will still need to be sent home and then get a confirmatory PCR test or a note from their provider that says there's an alternative diagnosis or for whatever reason there's no suspicion of COVID. The hope is when community transmission levels are much lower, hopefully by the end of the school year, the hope is to be able to use the rapid test for that case where a student comes in with, a headache and a runny nose and test negative, and if they feel up to it, go back to class. That would be ideal, but with our current transmission levels, we're not going to get accurate enough results. If a student is identified as a close contact to a positive case, but they have documented COVID in the past 90 days, do they need to quarantine if they are asymptomatic? As long as they don't have symptoms, they don't have to quarantine. But they should be really keeping a close eye on how they're feeling for the next 2 weeks after that exposure. If they start to get a sniffly nose and a headache, even if they might have seasonal allergies, it would be a good idea then to stay home and re-examine that situation. If I had a student go home with symptoms today and they had shield testing done yesterday, would this be sufficient for them, I'm assuming, to return from quarantine? I don't know what the pre-symptomatic period includes, but it does reference one in the shield FAQs. So this is kind of going back to what we said before. An RT-PCR negative from a test after symptom development is what's required to return. If that test occurred before symptoms started, it's not going to clear them. It's possible to accurately test negative one day and then develop symptoms the next day and, fully test positive the next day. The infectious period and the incubation period for this virus are relatively short compared to other viruses, and it really depends on individual biology, how quickly things develop. So that is something that is possible, and that's why previous negative tests go for, that time you were tested, but the next day is a new day. So hopefully that answers those questions. I will take a peek at the chat. Okay, so I wrote down a couple to address right before I presented. If a student is positive from a shield test and then the parent takes them for a PCR test outside of the school and it is negative, can the student return to school? No, positive is a positive. And I will double check to see which of these have been answered already, and then I will be tossing the rest to Pollock. Let's see. What is the state and county saying about, oh, actually, this is a good question for you, Pollock, if you want to introduce yourself and then answer the question. What is the state and county saying about allowing field trips via buses, including a band trip to Disney? I worry about these becoming super spreader events. Please comment.
Hi, first of all, thank you, Lex. For those who don't know me, my name is Palak Panchal. I'm the program manager for vaccine preventable disease at here at Cook County Department of Public Health. And many of you have communicated with me via emails, via phone calls, and I am happy to answer a lot of these questions that are presented on the chat. About field trips via buses, including a band trip to Disney. Again, I think this will be, I think that you can pretty much use the same travel recommendation as the one for CDC. You can have this group tested before they leave and then make sure this is a cohort, keep track of all the people where they were sitting in the buses. But at this point, I think we will just have to keep this trips via buses, just keep them as cohorts. And then after they come back, then the ideal thing would be to test if it's out of state. Test these students 3 to 4 days. Or if they don't want to test, then quarantine.
All right, Pollock, next question. For a test to stay program, can an antigen test be accepted?
No, I think we've already answered that question. For test to stay, I think there's a lot of confusion going on. For when a school has a shield testing program in place or any other weekly testing program, then we allow the test to stay options for close contacts. Now, if these, and for those close contacts, the shield test, for example, if your school already has shield tests, it's already a remarkable test with high sensitivity and specificity. It is a PCR test, so subsequent testing to confirm is not recommended. It's not going to change the result. If the person tests positive, they will just have to stay home, isolate. And if I think for that, since Lex already addressed, we are positive, we are considering positive as a positive. So is that what you mean, Melissa? That if a person tests positive in the SHIELD program, to return an antigen test be accepted, because we are only accepting RT-PCR. But again, test to stay is for SHIELD, which is PCR test, so subsequent tests won't be needed.
Okay, thanks, Pollock. Let's see, well, some of these were answered. Okay, next question. Did I understand correctly that test to stay can't be done outside of school and it has to be done via Shield or Binax, or can we accept test results from other testing sites?
I think it's for test to stay, for IDPH, and we have discussed this with the SHIELD people at the IDPH, and it has to be at school. Otherwise, we are not accepting any external tests unless a parental consent wasn't given. And if a parental consent wasn't given for SHIELD testing, then the child will have to follow either the 14-day quarantine or one of the shortened quarantine options.
Just to clarify, is the travel guidance a recommendation or a mandate?
They are recommendations. We highly, highly recommend. I mean, I do know that, because they are recommendations, people are most likely not want to get tested, but, we are in this pandemic. There's a high surge of Delta. I just think it's best not to take that precaution. If you don't want to get tested, then, just quarantine.
Do mask exemptions also apply for staff if they can get the proper medical documentation?
Yes. If they meet the proper documentation. I think IDPH has done a doctor would have to provide a lot of details for a person to be exempted from wearing mask.
If the IDPH release letter, which I'm assuming here comes from Salesforce, doesn't match our quarantine dates, what should we do?
I think there's another question. She had IDPH send a note 2 days before the end of quarantine, but said as of the date on the letter. Um, And that's when, like, I know our communication really helps between the school nurses and us. We would like to know who the student is, and that way we can actually touch base with the contact tracer and figure out if what went wrong in the communication with the parent of the student or the staff and the contact tracer maybe, and then we can figure things out how to make sure that our dates match.
Okay, that question was addressed. Can you put in writing that lunch exposures are not eligible for a test to stay? And I just want to say that I'm pretty sure on one of the IDPH calls they said they were going to include this in their guidance, but otherwise you can also use this as documentation or an explanation for your school or parents since these are recorded. Can you publish a statement about rapid PCR tests and acceptance? We are getting pushback from providers stating it is a PCR, so it is okay.
This I don't know what to say. Like Dr. Corpix may answer, but at this point we would they would have to provide that test result that actually says RT-PCR, and that's something we'll just have to push back on with the providers. I do know that maybe some providers are may not be on up to date on their knowledge about rapid PCR and PCR, and that's pretty common confusion to have.
Yeah, I would share that CDC link that I just put in the chat that very clearly says it's not as sensitive. And there's also the IDPH guidance makes that clear also. But yeah, I mean, it's tricky, definitely. But I would share that CDC link and the IDPH link.
Next question, can districts make a form, I think they're talking about, can CCDPH make a form for mask exemption that includes all the requirements? And I think we're updating the order for that and it will be listed. I don't know if that's out yet, but hang tight for that. It will be in writing or you can just use these slides. If a bus exposure wasn't observed by someone who confirmed that the students were correctly masked the whole time, are they still eligible for test to stay?
For this, I will always recommend that if you're unsure, it's always best to use a conservative approach. And again, if this happens, we can always discuss and figure out, but CCDPH is in support for schools if they want to implement a more conservative approach for prevention and control for COVID. We just ask that you don't go looser than the guidelines provided by IDPH and CCDPH.
Next question, and I don't, forgive me for this, Pollock, I'm not really sure what this is, but can Nunez be used as the weekly screening test for teachers? I'm not familiar personally with this Nunez test.
Me either. Is this for the test, the mandate for those who are not vaccinated and they're required to be weekly tested? Is that what the question is referring to?
I don't know. That was the full question that I read. If whoever asked this, if you want to pop in the chat and clarify, or you can email us if you have to hop off or something, we'll certainly answer your question then. But
Yeah,
yeah,
we would have
these
to
screening
research
tests
on.
can be antigen or PCR. Can Binax be used as a screening test for students if we institute a once-a-week screening program?
Yeah, I think we have already addressed it, Binex now or Shield, but if you have both, we recommend using Shield.
Okay, I submitted 2 questions regarding situations we are hearing about from downstate where school districts are being sued for enforcing quarantines and for mask mandates. Can you share any background on this and what CCDPH's perspective is on this? And then the articles were included. And I just want to say, well, one, legal has an answer for this that is way too much for me to include, but then also, um, the mask mandate and quarantine enforcing. The mask mandate is an executive order, so it's enforceable by law here. But then quarantine is codified in our Illinois infectious disease law and has been for a very, very long time. And quarantine is enforceable, and we've been using it literally since the plague in like the 1300s. So that is a very useful tool, and that one is not going to go anywhere. So it is
Yeah,
in
for
writing.
example,
Go-
I just wanted to, sorry, add to this. For example, for disease like measles or mumps or chickenpox, we are asking, those who are immune compromised or people who are exposed to do stay home, monitor their symptoms. It's essentially the same. It's only that in COVID now, it's very widespread knowledge about the quarantine. So I think a lot of the backlash that's coming about quarantine, people just weren't aware that this we have been using this for years and decades.
Next question, can you please discuss the 10-day quarantine versus 14 days and what the difference is? Are we allowed to use a 10-day quarantine period in Cook County?
Yes, so the 14-day quarantine period is the gold standard quarantine period. 2 to 14 days is the incubation period for the COVID virus when a person after exposure may develop symptoms during this time. So that is 14-day quarantine period is what we recommend always. The shortened quarantine options, which now include 7 and 10 days for children and adults, uh, we let the schools decide if you want to use a shortened quarantine. We are not going to be involved in managing. Just, the schools will have to make sure which student is on a 10-day quarantine or 7-day and can come back. And yes, we let the only time we are not allowing shortened quarantines is during outbreaks. No, automatically any student in the outbreak situation, if he or she is a close contact, they will have to fulfill 14 days of quarantine and no test to stay either.
And I just wanted to follow up if it would be helpful for people. I usually have a slide that's like what to consider when choosing your quarantine length. I can pop that back in when we send this out so that you have that to look at. Next question, is test to stay at school with an RT-PCR test through partnering with another lab permitted?
Again, we are only allowing test to stay options for in-school testing program like SHIELD. Right now, that is what the IDPH is recommending. We don't know if this may change later, but this is what it is right now.
We have some doctors who do not want to write an alternative diagnosis for COVID, but also don't suspect COVID. What can we accept in these situations?
I don't know. These are what we are requiring, and I think the schools have the right to push back on this with the physicians. I'm not sure if you are having discussion with these doctors or like let's say a student presents a note, doesn't have alternate diagnosis or no clinical suspicion. Are you having to call the physician's office and discuss with them? Is this where you're receiving the pushback? But otherwise, this is what we are highly recommending. And ultimately, I think, again, these are recommendations. So ultimately, it will be up to the schools to decide because we cannot enforce. Does that make sense?
Yeah, absolutely. Thank you, Pollock.
I just wanted to interrupt real fast. We're getting close to 3:30, so probably maybe 1 or 2 more questions, and we will have to follow up at next week's. Thank you for all these great questions, though.
I just have one more question and we'll end it there. What should we do for required testing for unvaccinated employee that had COVID in the last 90 days?
So if a person who's had COVID in the last 90 days doesn't need to go for weekly testing, just look up, 90 days from the date of test result.
All right, if you want to take us out, Kelly, everyone have a good weekend.
Thank you, Palak and Lex and Dr. Corpix. Jenna, if you wouldn't mind grabbing the chat for me while I adjourn. Thank you all. She said she got them all. You rock. So we will see you all next week. I know that there are a lot of questions that probably didn't get a chance to get answered. So we're going to try to follow up the best way that we can. And Dr. Corpus will share those links with me, and I will send all that information in one email next week with the slides. Thank you all for your support and your participation, and we will see you all next week. Enjoy the weekend.